Good morning, everyone. How's everyone doing today? Um, our coronavirus update for Tuesday, March 24th. So now there are now 46,000 cases in the U.S., 2,400 new cases in the past 24 hours. Our total deaths are 582. In Mercer County here, we've had 50 cases so far. No deaths have been reported here in Mercer County. So, you know, things continue to advance. People are, fearful. But, I think I want to reassure all people in our practice, people in the community, that I think we're all going to come through this fine. I was having a conversation with one of my patients yesterday who has some autoimmune disorder, a lot of allergies, mast cell disorders, possibly. And he was concerned about, what is called the cytokine storm, where cytokine storm is when you get the virus and it's not the your body attacking the virus that is the problem, but that the immune system gets out of control. Good morning, Betsy. Um, it's that response that you get that puts you at risk, where the immune system runs amok and creates almost like a sepsis type syndrome. Um, so, how do we know that's going to happen? Oftentimes we don't. Usually it's people with underlying conditions. A lot of my folks who have autoimmune disorders have been concerned about that. Um, what I said to him was that, if he'd had the flu, well, he had, he's had these issues, and he said he has. And, the flu can trigger a cytokine storm by a similar mechanism. Of course, it's not exactly the same, getting a cytokine storm from the flu and COVID-19, but it's similar enough that if you didn't respond to the flu with cytokine storms, that it's less likely that you'll respond to COVID-19 with a cytokine storm, assuming your state of health is approximately the same. So, but I mean, we should still practice social distancing. We should still be practicing, good hygiene. We should all be eating well. Morning, Michelle and Patrick. We should be taking care of each other. I think that there's a debate going on in the country now about whether we should be practicing these restrictive social policies, whether we should be canceling elective surgeries. Certainly, if you're in New York and New Jersey and some other states, obviously we're doing that. But appears to be a debate in some states that they don't want to do this. I think that will probably prolong the outbreak somewhat as the virus spreads into those states. We'll see a higher rate, and I think it'll take longer. So hope that our leaders will take the steps necessary to get this outbreak under control. Hope that, also the hospital workers can stay safe. It's one thing to go to a hospital and, be able to get the care that you need. But if the health system gets overwhelmed, then it is people may suffer and die needlessly. We certainly don't want to see that happen. And we certainly don't want to see healthcare workers get sick. So everything that anybody can do to help them get the supplies that they need for personal protective equipment is important. So does anybody have any questions that they want answered? Any burning questions for anybody, or in relation to this or to related issues? Um, you know, try to take my cues from the patients that I've been hearing from and seeing. Had somebody here in Mercer County who was wondering where to get tested. In Focus Urgent Care has a drive-through testing center, but you have to call ahead to make an appointment. I don't know exactly what their availability is. But in her family, one of her children had started, and she's got 4 children. One definitely tested positive. Another one was starting to show symptoms, and the mom had symptoms also. So she was wondering where to get tested. And they live with her 68-year-old dad lives with them. So she is certainly worried about him, not spreading it to him. So these are the challenges that people are facing, and more of us might be facing unless we practice, fairly strict social isolation. So, not seeing any questions from anybody, but if you have questions and want to send them to me, you could private message me if you want. I can either deal with them that way, or I can use them as a basis for topics to discuss. Be happy to do that, provide advice. So. All right. Unless there's anything, I'm going to sign out now, and I will see you at 8 o'clock tomorrow morning with the next update, next issues to be discussed. So, thank you everyone who joined. Nice to see some of you that I haven't heard from yet. So, good morning, Joanne. Good morning, Nancy. Krista, good morning. Jennifer, good morning. Thanks everyone who's come out to see me. And I'm trying to do this at 8 o'clock every morning, Monday through Saturday, 9 o'clock on Sunday. So, catch up with me there. And as you think of your questions, again, either you can ask during the forum, or you can, let me know beforehand, and I can talk about them in the morning summary. Okay. Everybody have a great day, and I'll see you tomorrow morning. Okay. Take care. Bye-bye.